Hi, my name is Julie Stevens, and I'm a survivor of stage 4 aggressive, inoperable, and chemo-resistant colon cancer. I was diagnosed in June of 2022 with no family history or symptoms, and I only had a 14% chance of living based on the current standard of care. But I was able to pivot from diagnosis to no evidence of disease in 9 months by drafting a team of 10 healthcare professionals to address all aspects of healing, by tracking my own leading indicator data, and by advocating for myself. I have a 20-year history in the field of industrial organizational psychology, and I partnered with the American Hospital Association around the rollout of Obamacare to define the talent requirements of healthcare professionals, so I had some advantages in building out my strategy. And now my goal is to help every single one of the 1.9 million Americans that newly diagnosed with cancer build their own holistic healing strategy. The truth is, your doctors are products of the education they received and the data they have access to. There's nothing that can change that. But you really need to understand that there's no data on anything that isn't a pharmaceutical approach, and it takes almost 17 years for a new discovery to become the standard of care. When you let that sink in, you realize why we're losing the battle on cancer. The reality is we conflate treating cancer and healing from cancer, but those are two very different things. Your oncologist is an expert on reducing the cancer burden in your body or treating cancer. They're not an expert or even educated on the socio-emotional aspects of being diagnosed with cancer, the palliative care strategies to reduce the impact of treating cancer, or how to heal the source of why cancer was expressed in your body. Because there is no research on this, because the end product isn't patentable or profitable. My goal is to change that and build the data set on what proves cancer across 6 toolboxes: pharmaceuticals, nutraceuticals, botanicals, holistic healing therapies like chiropractic or acupuncture, diet and eating habits, and lifestyle and environment. I'm building an organization called MOJO Health to change the way the game of cancer is played globally. This is an organization designed to meet the needs of patients, built by patients for patients. So we will collectively share our best practices and wisdom to increase the probability of treatment success and minimize the negative impact of cancer treatment. My book on holistic approaches to palliative care will be published in September, along with launching our podcast, MOJO Rising, to share the non-discussables of cancer, such as for young female patients, what are your fertility risks and options? What are your rights at work as a cancer patient? Or what is reflexology or acupuncture, and how can they help in your holistic healing strategy? My course for doctors, which has been approved 6 CEUs by the American Academy of Family Physicians, will launch in October in Mexico City. And we will be launching our holistic strategy builder for patients to go in and build their own holistic healing strategy across those 6 toolboxes later this year in Q4. We have built the formula for healing, the intellectual property to help patients build their strategy. We've also helped identify and build the team who's ready to execute. But we lack funding, and we need your help. We would love to set up a time to discuss how we can collectively work together to change the way the game of cancer is played globally. Thank you so much for your time, and we look forward to connecting with you and discussing how we could potentially work together to change the world.